Okay, good morning, student, once again. So tomorrow, today, what we will do is that we will try to complete, okay? We will whatever about vital signs remaining, everything we will complete. So we have discussed about some of the term that we got from pulse and all that. So let us discuss from the respiration as well. So you can just write it down, okay? There are some terms. So you write it down, tachypnea, Tachypnea. 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 TAC. Just now we have written from pulse, na? Tachycardia. So don't get confused. Now it is tachypnea. Tachypnea. I think you all heard this term, right? Rasmi, what is tachypnea? Any idea? If no, no problem. Any idea? Tachypnea? If no, I will pass the question to Finisha. Tachypnea? Okay. Tachypnea.
Medicine.
Medicine. Oh, okay, that's me. Okay. What is tachypnea, Finisha?
I don't know, ma'am.
Okay, no problem. Say it like Finisha. Okay, all of you, if you don't know, say you don't know. Okay, Senkamchi, what is tachypnea?
Ma'am, I don't know.
Okay. Nafisisa, you know what is tachypnea?
Ma'am, abnormally rapid breathing.
Yes, this is abnormally rapid breathing. Okay, Nafisisa, very good. It's abnormally rapid breathing. Okay, so before it was tachy. Anything that relate to tachy means it's all like high. Okay, so the before it was the pulse rate was abnormally like high. Okay, so it was tachycardia. So now it is tachypnea. So tachypnea means when your respiratory rate, okay, your respiratory, what was the normal respiratory rate? Yeah, that day I have given you all on Saturday, normal respiratory rate. Vishal bolo to? Mini Saturday ko diya. Normal respiratory rate. Okay, no problem, Vishal. You take your time. Okay. Long jump, can you please tell me what is the normal respiratory rate? Long jump, can you please tell me what is the normal respiratory rate? Long jump, can you please tell me what is the normal respiratory rate? Okay, long jump is absent. Okay, rich person, tell me what is normal respiratory rate?
12 to 16, ma'am.
Only 16.
12 to 16.
16 to?
12.
16 to 12. From many to, oh
12
God.
to 16, ma'am. 12 to 16. 12 to 16.
No, rich person, you were absent or what? Like, yes, Ishan, can you please tell rich person the answer?
16 to 20.
Yes, rich person, write down 16 to 20, okay? 20.
Yes, ma'am.
Write down 16 to 20 breaths per minute, okay? Write down what is tachypnea. Tachypnea means you can just write down in your language also, okay? According to how you like convenient. So respiratory rate increases when the respiratory rate increases above 20 breaths per minute, then it is called this tachypnea. Or you can simply write respiratory rate greater than 20 breaths per minute. Respiratory rate greater than 20 breaths per minute. BREATHs. Okay, means don't get confused. Okay, like your your breathing. Okay, your breathing is normal, like your rate of breathing is normal. Okay, how your breathing is normal means not normal, actually regular. Your breathing is regular, but the only thing is that, like, even though it is normal, but it is abnormally high, it is abnormally rapid. And then it's not that your breathing stop, your breathing is not regular. It's not like that. So write it down. Next is bradypnea. 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 Bradypnea.
Ma'am,
Yes.
please repeat.
Oh, the previous one. Okay, okay. The previous one was tachy. Oh, which one I will repeat? Brady
No, no,
spelling.
bradypnea
Oh, okay,
spelling.
okay,
Yes,
okay.
ma'am.
Write down. Bradypnea. Again, I will repeat. Bradypnea. Bradypnea.
Oh, thank you, ma'am.
Okay, welcome. Bradypnea. So the meaning of bradypnea is, you can write down, when respiratory rate is less than 10 breaths per minute. Okay, it's less than 10. Before it was tachypnea. Now it was greater than this. It was greater than 20. So bradypnea, it is less than 10. All the unit are same. Okay, that breaths per minute. All this. Okay. Okay. So when your breathing is totally absent, okay, when your breathing is totally absent, so there is a one medical term. So anyone have any idea? Absence of breathing is known as what? Anyone have any idea? Which person, you have any idea? Absence of breathing? Breathing is absent. Any
No,
idea?
ma'am.
Okay, okay, no problem. Okay,
No, ma'am.
Nunu, you have any idea what is the term that was called absence of breathing? Absence of breathing. From the absence of breathing means what? What was the medical term? Okay. Okay, all of you write down. Okay, apnea. A-P-N-E-A. A-P-N-E-A. Apnea. Apnea का मतलब है absence of breathing. When someone don't breathe anymore now, then we call it as apnea. So now I hope you are totally clear with the respiration. Respiration, all of you know the definition. Now respiration means this is the act of breathing. Okay, how we breathe, that is known as respiration. So respiration, you all know now, it involves two process, inspiration and expiration. All those details is not much required. Just know that respiration means it is the act of how we human being we breathe. This is the act of breathing. And then from there, like our breathing also, it have got its normal value. Okay, that was 16 to 20 breaths per minute. But when someone breathing is abnormally low, okay, when someone, like the rate of breathing is abnormally slow down, or when it is low, it is known as means the value means the rate is less than 10 beats per minute. That means the normal was 16 to 20 now. So, but if it is less than 10 breaths per minute, then that is termed as bradypnea. And then again, we also come across about tachypnea. That means when someone breathing is abnormally rapid. Okay, abnormally, like it is rapid, but it is regular. So at that time, what we call it as means the rate is when it is greater than 20 breaths per minute. So now everything you know, when it is low, when it is high, and what is the normal value. When it is totally absent, it is known as apnea. So all of you, are you clear? Totally clear about respiration? All of you? Or you want to ask anything? Are you clear about
Yes,
respiration?
ma'am.
Kab low hota, kab high hota, what is the normal value when it is the absence of breathing? Everything, are you clear?
Yes, ma'am.
Okay, okay. Okay. Have you ever had the term dyspnea? I think I gave this in offline classes, I think, like when we were having some classes. So, dyspnea. What was dyspnea? Ilasara, what was dyspnea? Miss Ilasara, you have any
Don't know,
idea?
ma'am.
Okay, okay. No,
No,
Srijana,
ma'am.
dyspnea. I'll ask one by one.
Ma'am, shortness of breath.
Okay. Shortness of breath. Okay, all of you don't forget. SOB I gave not shortness of breath, or you can also call shortness of breath, difficulty in breathing. Okay, you can call like that. So that is dyspnea. The spelling is dyspnea, dyspnea. Okay. Okay. And there are also like that of pulse. Okay, there are also some factor. Okay, that used to like increase as well as decrease the rate of respiration. Okay, when we do exercise. Okay, when we do exercise, what happens is that this respiration increases during exercise, and during acute pain also respiration increases. During anxiety also respiratory rate increases. Okay, all this just keep in your like mind. And then a person who used to smoke. Okay, smoking means smoke when someone smoke for a long period of time, or a long time smoking person. Okay, this respiratory rate increases, so it can be abnormally high. So it is very, very bad to smoke. And then there are some medication. Okay, it means like there are some medication that also used to increase our respiration. And then what are the like factor? Okay, what are the factor that used to like decrease our respiration? There are also some medication like analgesic. When someone used to take analgesic sedative, you know now what is analgesic? I already give you all. You know now what is analgesic? Oh God, you all of you know what is analgesic or analgesic? Anyone? Babok lang?
No, ma'am.
Any one of you? Darshana, what is analgesic? When you feel pain, what type of medicine you used to eat when you feel pain? Infection, every one of you know, you used to take antibiotic, okay? So when you feel pain, okay, we take medication, okay? And the class of group or the class of medication that is taken during pain is known as analgesic, okay? analgesic. So whenever you are injury, whenever you are hurt, you used to take some painkiller. Okay, all those are known as analgesic. So all of you, are you clear? What is analgesic?
Yes, ma'am.
Okay, those are the medication. Okay, those type of medication. Those are the medication that used to means decrease our respiration. So too much intake of all those medication can also be harmful. So like never take excess amount. And there are also some medication like sedative. So have you heard about sedative? Sedative, sedative, sedative. Sedative. When we can't sleep, what we mainly take? Some sedative, sleeping pills and all. We used to take. We used to take some type of drug that used to induce our sleep, right? So that means like when someone have insomnia, someone can't sleep at the time, they used to take all this sedative now. So that all this medication can also like decrease your respiration. So those are some of the factors. You just need to know all those things, okay? Just for your knowledge. So are you clear about respiration, all of you? How many types of thermometer we have? How many types of thermometer we have? Samuel, thermometer कितना types का होता है?
Ma'am, two.
What about other?
Ma'am, two.
Okay, Samuel said 2. What about other?
Two, ma'am.
Okay, actually not like, I know why you are saying 2, because you have heard only about the mercury, that mercury glass thermometer, not that mercury glass thermometer. You heard this, right? That normal thermometer. You heard, right? This
Yes,
mercury,
ma'am.
yes, those was the thermometer, and the other one, I think what you all are saying is the digital one, right? Digital thermometer, isn't it?
Yes, ma'am.
Yes, ma'am.
Oh, but you know, like before, there used to be like 4 types of thermometer. Okay, nowadays we mainly use those two. That is why like those two are mainly focused. Okay, but actually there are 4 types of thermometer. Okay, that are available for determining our body temperature. Okay, that is like mercury in glass. Okay, there that is still it is being used. This is the more what we can simply say that this is the most commonly thermometer that is used, okay, which was made up of glass tube. And in the label and all, it can be labeled in the Fahrenheit or centigrade, I already mentioned. And there is also electronic thermometer, that is the digital one, okay, that is the in the battery system. And then there is also another thermometer, okay, which we don't get nowadays, that is this disposable thermometer. Before, previously, there also used to be disposable thermometer, that is disposable to, you know, not one time use. So all this disposable thermometer. And there is also another thermometer, that is tympanic membrane thermometer. Tympanic membrane thermometer, okay, all those you just keep in your knowledge, all those tympanic membrane thermometer. But mostly 2 types are used, that is the this mercury glass thermometer and the digital one. So blood pressure and all, I already gave you all, right? Blood pressure, everything. Can anyone tell me, woman, what will be the factor that will affect your blood pressures? Factors affecting blood pressure. Can anyone tell me what are the factors that will affect your blood pressure? It's only 11:04. We still have time. Factor, you know the normal value of blood pressure, when it is called hypotension, when it is called hypertension, everything I gave you all, along with the unit, everything. So now tell me, what are the like factors that will affect your blood pressures? There are some factors, not it. So will age affect your blood pressure? Age, 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 young age, old age, everything is there now, even at birth. And always know that, okay, the blood pressure is always low, means it is lowest at birth, okay, during the childbirth, okay, the blood pressure is lowest at birth. And means like, and then again, it slowly and steadily, it used to increase in adolescent, okay, in adult it increases, and again it used to decrease with aging. Are you clear? These are the factor. Just know that, means when the means like during the childbirth, okay, the time blood pressure is low, and in adolescent it little bit it used to rise up, and again it used to decrease during aging. But what you know is that it's not that old age people, their BPs used to be low. It's not like that, okay. Means due to their increase in peripheral resistance, okay, there is a peripheral resistance. Because of this peripheral resistance, what happened is that the blood pressure used to increase in the elderly. So you can just write it down if you want to know, is that due to increase in peripheral resistance, the blood pressure increase in the elderly. Due to peripheral resistance, PERIPHERAL. Again, I will repeat, PERIPHERAL. Peripheral, PERIPHERAL. Write it together, okay? Peripheral. Because of this peripheral resistance, the blood pressure increases in the elderly. And whom will I ask? Shelly, can you please tell me the women blood pressure are like women have lower blood pressure than men, or else men have lower blood pressure than women, or else their blood pressure are same? All this
Ma'am, woman.
okay. Why? Why women blood pressures are like higher? When it is? From the birth
Ma'am,
itself?
during
Yes, say.
ma'am, during birth, giving child.
During child. Okay, any one of you, Ilasara, you have idea? Nafishisa, Malvina, Finisha, Senkamchi, Ishan, Rasmi, Yatu, Nunu, Surajit, Rudolph, Samuel, Rich Person, any one of you? Monica, anyone have any idea? Anyone have any idea? Okay, if you don't have any
No,
idea,
ma'am.
okay. Means like in the sex wise also there is a factor that affect our blood pressure, okay? Sex also, what happened is that women used to have low blood pressure than men of the same age. Suppose you are 18 years old and your suppose Vishal is 18 years old and Srijana is 18 years old, okay? Suppose I'm just giving an example of like, or else Bisal is 20, Sujana is 20. They are of the same age. But what happened is that the woman will have lower blood pressure as compared to, Miss Srijana will have lower blood pressure as compared to that of Bishal, even though they both are 20 years old. Okay? Because Srijana is a woman and Vishal is a man, that's why like you Srijana will have low blood pressure. But what happened is that after menopause, the woman pressure reading used to increase over men. Always know this, okay? But after menopause, so menopause, to all of you know, I don't need to repeat. So after menopause, the woman blood pressure used to be much increased as compared to that of men. So are you clear how sex is also like the factor that affect our blood pressure? How sex affect our blood pressure? Are you clear?
Yes, ma'am.
Yes, ma'am.
Okay, all this you need to know, small things. So, and this exercise and all these are also used to increase the blood pressures. Even this emotional, okay, when you are anger, when you are fear, when you are too much excitement, when you are too much painful, okay, this also increase your like blood pressure. And then even when you take someone blood pressure, okay, this blood pressure, always try to take the blood pressure in a supine position. So all of you know what is supine position? SUPINE, supine position. All of you know what is supine position? Supine position, any idea?
No, ma'am.
Okay, supine position means suppose you are just lying down, okay? You are just lying down. You are sitting and lying down and facing above the sky. Means like not, how to say, you are not sleeping. Ulta nahi so rahi ho, huh? You are just lying down. Your leg are straight. You are just lying down, okay? Just lying down position is known as supine position. Supine position is just the medical term, but in actual it is just the lying down, okay? You are just lying down, facing like facing above the sky. It's like that. Ulta nahi so rahi. So in that, when someone is in supine position, na, so in that position, always try to take the like blood pressure. And then what happened is that like when you take in standing position, na, so blood pressure always tends to be low in supine position, okay, in comparison to that of in sitting or else in standing position. So that is why supine position is the most like preferable side, means positions. So there are also certain drugs that increase all this. So it's not much needed. Oh, okay. I want to ask you one question. So when you take this when you take blood pressures. Now, when you take blood pressure, there is a systolic pressure and there is a diastolic pressure. So the differences between the systolic and diastolic pressure. Okay. So what was the name of that term? You were taking someone blood pressure. What is that? Please mute yourself. Okay, you know about systolic pressure, you know about diastolic pressure, okay? So the differences between that two blood pressure is known as what? Any idea? Any idea? Any idea? If no, say I will give you now.
Ma'am.
Okay, write it down. Pulse pressure. P-U-L-S-E. Pulse pressure. Pulse pressure. Pulse pressure. So pulse pressure, okay, P-U-L-S-E-P-R-E-S-S-E-Y, pulse pressure. So pulse pressure, this is the difference between systolic and diastolic pressure. Difference between systolic and diastolic pressure. Srijana, you can take attendance, huh? You can take the screenshot. Only 10 minutes and it's 11:13, okay. Okay, so the differences between systolic and diastolic pressure is known as pulse pressure. And then the normal value of pulse pressure is 30 to 40 mmHg. Write down normal. Normal value is 30 to 40 mmHg. mmHg. So all these small things, little bits, now all these things you just need to know. Okay, all of you are clear now about the vital signs. With this, we have like completed the details, brief details about vital signs. So all of you are clear about temperature, about temperature. So, and about what was that? About this pulse. In temperature, we have discussed now all the, we'll have little bit revision in temperature. We have discussed all the normal value of temperature, and in oral, what is the normal rectal, axilla, everything we have discussed in the temperature. And even about pyrexia, that is like means fever, that is fever. When you check someone temperature, how will you means like recognize, or how will you come to know now that he or she have fever? I have already given you all the normal value, that is hypothermia, low pyrexia, moderate, high, hyper, everything you got in the this temperature. And then after temperature also you already like know how to convert Fahrenheit into Celsius, again how to convert Celsius into like Fahrenheit, again all those things. And then again you all already got about the pulse. After T it is P, not TPR. So in pulse you got the normal value, and then after that when the pulse rate is low, that is bradycardia. When it is high, it is tachycardia. All this you already got it. So, and the factors also, what are the factors that increase or decrease? And there are 9 sites of taking pulse. So all those things. And then after that, respiration, normal value, I give you all 16 to 20 breaths per minute. When it is high, it is 20, means above 20, okay, about 20 breaths per minute. It is low, then it is below this 10 breaths per minute, all these things. And what is bradypnea, tachypnea, apnea, everything. And then after that, you all discuss about the blood pressures, right? So in blood pressure also, we already discussed about the normal value, everything. So are you clear? Are you clear, all of you? All of you, vital signs, are you clear?
Yes, ma'am.
Okay.
Yes.
Oh, let me ask you all one very interesting question. Suppose you know everything you know about blood pressure, okay? And you were checking someone blood pressures, and then the first sound that you heard was the systolic, okay? Systolic blood pressures. Then after that, like the beats or the sounds that end, okay? The last sound that you heard is the diastolic. So that particular sound is known as what? In medically, it is known as what? Have you ever studied about the sound? Because when you like put into the stethoscope, now you will hear the sound, dhap, 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 something. You will hear like that. So that particular first sound was known as systolic. So what is the, like in medically, those sound, the systolic and diastolic sound that you heard was known as what? Any idea? Sound? You don't need to say like, I heard the first sound, so it is a systolic. It's not like that. You need to know what is the name of that particular sound. Have you ever been told about this sound, or else you will be hearing for the first time? Samuel?
Ma'am, first time.
Okay, you write down. There is so less time. Write down. Koro. Korotkov sound, okay? It is Korotkov sound. So Koro, write down. K-O-R-O-T. K-O-R-O-T. K-O-double-F. Don't write separately, okay? Write all together. K-O-R-O-T. K-O-double-F. Korotkov sound. This is the name of the sound, okay? Okay. All of you, how do you feel after knowing very like detail about vital signs? What is your feeling, Finisha? You're feeling
Yes,
good?
ma'am. Yes, ma'am.
All of you? Babakla? All of you, will you be able to check someone BP now? Someone temperature? Someone pulse? All of you? Okay. Means like whatever you study now, everything, like always try to clear your concept first. Like that will help you in your future also. Like totally try to clear. Don't just read like this is the normal value done. It's not like that. You try to know, because all those are, if it is not practically involved, it is not necessary. Okay, but all this vital sign you need to perform practically. And you know, like when even means in your future also, not like it will be very much helpful when you become like a like someone like you mothers or someone father in future also, it will be helpful, because you don't need to go every time to like consult the doctor every time now. So you, once you have the means the instrument, the medicines or at your place now, at your home, then what happens is that you can perform by yourself also. That is why to perform by yourself without taking the consultation of anyone. Now, the main thing is that clear your concept first. Then you will have so much of confidence. If someone asks you anything also, you can just beat them up. So, okay, then only 1 minute left. So, do you have any questions? It's only 1 minute left. Okay, okay. If there is no questions, then that's all for today. Okay. Thank you, everyone. Have a nice day.
Thank you, ma'am.
You, ma'am.
Thank you, ma'am.
Thank you, ma'am.